Hello people, in this video we want to understand how to read community medicine. Community medicine, also called as PSM, that is preventive and social medicine, one of the most black and white boring topics for students. So basically how to read it, get the textbook, park. If you're reading anything else, then up to you. But park exact headings, you need to know exact under each heading what are the subheadings, topics, you need to know those, and you'll have to approach the question with this type of answer only. Let us say in the exam they have given you a simple topic, health education. You think health education, you'll write so much, right? They ask you approach to health education and you cannot write lectures or symposiums or seminars. No, that is not the approach. The approach here is 4 well-known approaches to health education. Regulatory approach, managed. Then you have service approach, health education approach, and primary healthcare approach. Guys, you have to write these 4 points to get marks. So keep park handy. Black and white textbook doesn't have any images, not at all friendly to you. You have to read this. Okay. Anyways, let's look at the silver lining here. You have question banks which come with important questions. So buy the companions and see what important questions are there, how many times they have been asked, get the previous question papers, important, and read the high priority ones which have been asked several times. Look at some high priority questions, guys. Modes of intervention, epidemiology, randomized control trial, measles, geriatrics, natural history of disease, pasteurization of milk, integrated vector control. Remember, if you know how to control mosquito, all the anti-larval, anti-adult measures, etc., that will give you so many marks. Primary health center, polio, filariasis, leprosy, coronary heart disease. In this, you have to know that Framingham study, guys, very important. Then school health, human development index, you should know how to calculate it. What are the indicators that go into making this human development index, right? Then you should know about carriers, quarantine versus isolation, epidemic, how to differentiate epidemic, pandemic, outbreak, endemics. What are the difference between these terminologies? Case control study versus cohort study. You should know rubella, hepatitis, cancer. So many things you need to know. These are all the important topics. So get the question bank, guys. Then coming to solved question papers. So you get books like this which have the previous year question papers solved. Sometimes you can know how to approach the answer. Not very preferred. You can read the textbook with the question bank. Okay. Then listen in class, guys, because they will tell you things, and if you listen there, half of the thing is done. More than half of things are done there, right? You can know what is new. You can know the latest treatment, especially tuberculosis and all. Their treatment keeps on getting updated, isn't it? So you can know the important things by listening there. Then coming to these programs, right? All these programs go from control to elimination to eradication. So you should understand there is a national leprosy control program. Then it becomes a national leprosy elimination program. The same thing becomes a national leprosy eradication program, which we have currently, isn't it? Full forms, when it comes to full forms of these programs, guys, N will usually mean national, W will mean world, and U will mean united, like UNICEF and UN, United Nations, etc. P will usually mean prevention program or a plan. So try to substitute and make the full form. M usually will mean maternal, mother. Okay. C will usually be child, otherwise it will be control. Okay. A will usually refer to adolescent. S will be suraksha or surveillance. I will usually mean integrated vector control program. Remember all that. International, it can be sometimes like ILO is International Labour Organization. In the exam, they can simply give you ILO and make you write about it. You won't know what it is. It is international. And L usually, you know, here in this case, international is labor organization. Okay, guys. So you should understand how to crack these full forms. Then the flow. So understand the flow, guys. When in natural history of disease, you have prevention. Just go with this prevention. Okay. For everything, you have to write prevention as first you will write primordial prevention. Then you will write primary prevention. Then you will write secondary prevention. Then you will write tertiary prevention. For every question they will give you, you will have to follow prevention of filariasis, primordial, primary, secondary, tertiary. Same thing, always the same flow. And each of these will have some modes of intervention under them. Like primary prevention, what is the mode of intervention? Health education, health promotion. Then specific protection you have, like immunization. Secondary prevention means the disease has already occurred. So do early diagnosis and treatment, right? Do you know all this or Look at this. So you have levels of prevention. You have primordial prevention, primary, secondary, tertiary. This is the natural history of disease, right? Are you able to see? See here, under each of these, you have some specific modes of intervention: health promotion, specific protection, early diagnosis and treatment. Under tertiary, you have disability limitation and rehabilitation. Everything will proceed this way, and this is how you will explain prevention in every disease. Okay? If you know these many terms and you have understood what it is, you have understood community medicine. Primordial prevention means risk factor you will not allow. Primary prevention means you will not allow disease to happen. Secondary prevention means disease has occurred, you try to minimize the effects of it. Tertiary means the disease has complicated, you try to limit the disability by that disease and you try to rehabilitate that person. As simple as that. If you've understood this much, you know half of community medicine. Great. Then let's move on. Important topics, guys. Understand National Immunization Schedule. It should be in your brain like that. It is not at all very difficult, is it? Look at the National Immunization Schedule, guys. It's so easy. Birth, 6, 10, 14 for everything. You'll write 6, 10, 14, isn't it? Then these are all the mandatory ones, okay? Don't look at what the extra they are giving, like Japanese encephalitis, etc., rota, and pneumococcal. Those are not everywhere. They are in some endemic areas only. So what is perfect that you should know? At least this much, below 5 years, this much you should know. Like at birth, what will they give? 3 things. Say it. BCG, oral polio, hepatitis B. This is, at birth, they give 3 things. And these are all what? 0 dose. They are not at all counted as 1 also. Isn't it? Then you have 6, 10, 14. Half the world is 6, 10, 14. Oral polio, 1, 2, 3. Pentavalent, 1, 2, 3. So easy. Now they have what? Fractional dose of IPV. They're giving fractional. They're not giving the inactivated polio vaccine. They're giving the fractional dose. So there is FIPV1 and FIP2 here. Only 2 enough. Measles, rubella. Along with measles, rubella only, they'll always give Japanese encephalitis. Look at this. Measles, rubella, Japanese encephalitis. Measles, rubella, Japanese encephalitis. But they'll give only in endemic areas. So simple, isn't it? In India, what is there? Malaria, polio. If you know these two, you have passed community medicine, guys. Malaria, you should know everything about it. Polio, everything about it. You will pass, okay, if you know this much. Then coming to spraying with words. Your entire paper should be sprayed with prevention. All the parameters of prevention. Planning. Significance. Something you will write, right? How a community medicine guy will think. Like that. Spray these words everywhere. Chapters, do you want to know what is important, guys? So basically, Millennium Development Goals have now become Sustainable Development Goals, guys. Then what else you want? Leprosy, you should know. Tuberculosis elimination program, DOTS, you should know. Then health indicators, mortality indicators, morbidity indicators. Then remember maternal mortality, MMR, if they tell you. MMR is maternal mortality ratio. MMR can also mean measles, rubella vaccine, measles, mumps, rubella. But MMR can also mean maternal mortality ratio. Remember, it is a ratio, RATIO. It is not rate. Okay, that's what you have to know. Then coming to epidemiological methods, this chapter you should know that what you have is case control study and cohort study. Cohort study means there's a prospective study. Case control means you go backwards and you try to look at history. So that is what is case control study, and this one is cohort study is looking forward. This much if you have understood, great. Malaria, very important. Emporiatrics means care for those international travelers. They should take some vaccines, etc. Then what else? Dengue also important, guys. Focus on dengue if you have time. Measles, Ebola. Then try to crack this. We already told you what these full forms will mean. I is what? Integrated. Yes. C is child, we told you. D is development in this. And S is what? Integrated development. Integrated child development service. All the Anganwadi things come in there. Whenever anything says IDD, it means iodine deficiency disorder. Because earlier they were calling it goiter, but no, it doesn't cause only goiter. It causes so many things. So iodine deficiency disorders, IDD. Anywhere you see national program IDD, it will be iodine. Okay. Rabies also important, guys. Focus on that if you can. John Snow is the father of epidemiology, so he's your god for epidemiology. Remember this. Then what else? Asha worker, you know what Asha worker is. So basically in grassroots level, you have Asha worker and health, Asha workers, auxiliary nurse, midwife, Anganwadi workers, etc. Above them, you have the health workers. Above them, you have the health assistants. So you should know this. Okay. Similarly, you have primary health care, right? So look at this. Let's open this PPT. Primary health care. So primary health care, what and all you have? Primary health care, you have the sub-centers and PHCs. In secondary level, you have the community health centers. Then tertiary, you have these medical colleges, etc. Guys, basics we are telling you, just know, okay? All these are some important things that you can learn, okay? So many things are there, guys. What else you want us to tell you about? AWW means Anganwadi worker. Okay, I think you have got an idea as to what is important in community medicine. Let's just scroll down to see a few more things. All this you read, guys. Basically, in this video, we told you how to read community medicine. So this will help your theory. But otherwise, practical, how will it help? Practical, you will have to learn how to go and take these family studies, ask family what questions to ask, family study, and then you will also meet patients, and community medicine wise, what and all you will add to the history. So normal history in hospital, you will take that, you know how to take. But in community medicine, when you take history, you also take their socioeconomic status. How will you calculate education, a profession, income? You should classify that. I think you do for everything. But you heard one more thing you add is their diet history in much in detail, family history, their dwelling surroundings. All these are important, isn't it? Are we missing something? Social factors because of which the disease occurred. Is he, what is his family background? A lot of things go in here, guys. Social factors, I can think. What else? Here you assess the attitude to the disease, economic factors that led to the disease, what led to the disease, what can be done to stop this kind of disease. All that you will do in this community medicine kind of studies, okay? Whatever we told you now is the practical part. When you're going and meeting people, surveillance, epidemiology, those parameters you have to collect, okay? So in this video, we have looked at how to read community medicine. Bye-bye. One more thing, guys, community medicine is the only, when you're taking history, right, it is the only place in community medicine only you will ask that guy whether he's living in nuclear family or joint family, and how many bathrooms are there, how many bedrooms are there, etc. And does he keep his house clean? Does he throw his garbage properly out? Does he cook with neat things? Does he have a LPG? Does he have a etc.? Not to burden you, but you understood, right? Family study, community medicine history taking is very different from your normal history taking, okay? Normal history taking, you will bother more about the diagnosis, right? And treatment. But here you will bother more about why it happened and how to prevent. And how is his family life, etc.